Hello, Dr. Hiroki. It's such a pleasure being here with you. I know you for so many years, and I met you at the Southwest Acupuncture School. You were teaching. You actually were the director. Yeah, and I have seen you grown so much. You're so different than anybody else that I've ever had acupuncture with, and I would like for you to explain a little bit about the different modalities. I know you're always growing, but what is your heartfelt modality that you follow?
Yes, at first I can tell my style is based on officially or technically classified as acupuncture and Oriental medicine, especially traditional Japanese style of acupuncture, which I learned from Japanese practitioners, including legendary practitioners, personally. But I kind of define my treatment as treatment or therapy, rather than I'm not interested in particular style or particular tool. So my goal is to heal patient. So I consider what I do as a medicine and healing medicine. So I pursue whatever that works for that purpose. So that's what I can say. That's why even though I use needles, I use moxa exhaustion technique, and I use Chinese herbs, also lots of body work, including shiatsu and tuina. But these are just a tool. So my style is treatment. So that's the only thing I'm looking for.
Yeah. I noticed that you very tuned in to the person, because I can come here and you know exactly the place in my body and the connection to it. Sometimes we feel something in one place, but it starts somewhere else. So all the new modalities that you have learned, they are just very powerful, and you're getting more and more powerful. Because my experience with you is that you've helped me very quickly and with connection, because it's so important to connect with the patient. Most practitioners, and including DMDs, the traditional medicine, they don't connect with the patient. They have a preconceived knowledge of what it seems to be going on. They don't listen. You're a very good listener. Is that part of your tools?
Yes, very much. Because what I'm looking for is to understand what is a state of healed, like what healing means, or what healthy state means. And for that, to begin with, I think myself as a person, as a living person, living creature, has to be healthy. And my kind of concept is to share my health with patient. And for that, I'm not when I'm saying by saying that I'm not saying I'm the healthy person, ideal person. But rather than that, when I connect to my patient, the connection, there's kind of connection and a flow of energy established. In that case, myself and also patient and myself both becoming healthier. And what I feel, then I try to sort of imagine the healthy state with the when our connection established, and to guide both of us to the point of health.
Yeah.
It's like
It's a synergy,
Yeah, synergy, yes.
It's a it's a synergy. When I learned my modalities of healing, the Dr. Appledger said, give a session, you get a session. That's the case, because we are having an exchange of energy, right? And you, I noticed, are very powerful in your intention. You set intentions
Yes, intention is actually the source of reality. That's what I perceive.
Mm-hmm.
So when I see my patient, I control myself and I try to keep myself in a healthy and happy state.
Mm-hmm.
But patient come to see me because they need
Yeah.
be healthier, happier.
Mm-hmm.
So, but I know they are at a deep level. Their life is completely perfect.
Mm-hmm.
But there is a slightly some like a wave kind of some unhealthy or some trouble, just not connecting to their self.
Mm-hmm.
So my guide is to establish synergetic reality and try to send the normal, calm energy to them.
Yeah.
Yeah.
You're very kind. That's what I gotta say about you. I feel very safe in the space, you know? My body usually relax right away, and many times I just go fully to sleep. I even have dreams in that small amount of time that I'm here, but you know, it's that kindness, that non-judgmental part of you that you put out for me, that, you know, or demanding, or you need to do this, or you need to do that, or you never, ever put any kind of programming. If I said to you, oh, this hurts, you don't say to me, well, you done this, or you done that, or you just like very kindly go to the work, and it's almost like a dance with you, and it's not, I don't feel that I like what did I do, or I should be doing something, you know, all that judgment, all that stuff that we do, you know, my nervous system can relax, and as I understand, the more relaxed the nervous system, the more the healing can happen.